Sports. I'm Pat Corrales, and we are going to talk about something that is pertinent for women, not only in menopause, but actually as they age overall, and that's osteoporosis. And even when they're not aging, this is a concern for all women, and that is our bone health. So, what is osteoporosis? Well, it's characterized by what's called a low bone mass, and that is a disruption of the architecture of the bone and making our bones very fragile to breaking. Osteopenia is actually Greek for low bone mass. And what it means is that our density of bone is lower than normal, but not quite to the point of osteoporosis. And the main difference between these two is really a measurement of the bone mineral density. And we give it a score, which is called a T score, and osteopenia is a score between -1 and -2.5, and osteoporosis is any number basically lower than a -2.5. What causes this? Well, the main cause in menopause is the reduction in estrogen. This disrupts the normal cycle of bone cell regeneration. And there are two kinds of bone cells. One is called an osteoclast, which is a bone resorbing cell, which breaks up bone. And the other one is called an osteoblast, which is bone forming. And the disruption when the estrogen goes lower creates more osteoclast function and lower osteoblast function. And so you develop this abnormal bone. And the bone that's affected the most is what's called trabecular bone, the spongy inner cavity of the bone. And the ones most vulnerable to fracture is really the vertebra or your spine, the proximal femur, which is your hip, and the distal radius, which is your wrist. And those are the biggest sites of bone fracture that occur in women, particularly postmenopausal. This is a radiograph, an X-ray of actually what it looks like. And what you see on the right as you're facing it is healthy bone, a healthy hip bone. And then what you see on the left is kind of a blackness. The bone is not healthy, it's actually missing. And so that's what makes it most vulnerable to fracture. On the far right, you're seeing a picture, an x-ray of your spine, and you can see that the vertebrae are usually rectangles. So the arrow is pointing not to a rectangle, but actually to a flattened pancake, which is what happens when you see vertebral or spinal fractures. The bone just collapses on itself, and you can imagine that the little nerves coming out from the spinal canal are being squished. And that's what causes sciatic pain or lots of other pain that we sometimes get as we age. How common is this? Well, for all adults over the age of 50, we have nearly 12.5% of all adults developing this. It's much more common in women, 20% compared to only 4% in men. And osteoporosis affects 8 million women over the age of 50. And by the age of 85, 70% of us are going to develop osteoporosis, whereas only a third of men will have it. More than 1.5 million osteoporosis related fractures occur every year in the United States. And the most common sites, we said, for these osteoporotic changes that lead to the fractures are the spine, with compression fractures of 300,000, the hip at 750,000, and the wrist at $250,000. The worldwide annual vertebral fractures vary because there are different genetic backgrounds in different parts of the country. And so in the United States, those are our figures. We're one of the highest in the world. And hip fractures in patients not only hurts, but actually leads to higher death rates. Nearly 21 to 30% of those who have had a fracture within that year will die. What are the risk factors? Well, the problem with osteoporosis is it's usually silent. So the real goal for diagnosing it and paying attention to your bone mineral density is to avoid fractures. The strongest non-bone mineral density risk for factors are going to be just aging. And so what we want is to avoid aging, but we can't do that. What we can do, though, is prevent a fracture. And if we've had a fracture, prevent another one, because that's going to lead to higher death rates. Other risk of factors include a high fall risk. If we're impaired mobility to begin with, steroids lead to higher rates of osteoporosis if you're on chronic steroids for over 3 months. If you're very, very thin, you also have a problem. If you're a cigarette smoking, that increases your rate of osteoporosis. If you're excess alcohol intake, also. And if you've already had some changes in your vertebra, you're more likely to have more changes. And finally, there are diseases which have what we call secondary causes of osteoporosis. And that depends really on your medical history. So how can we prevent hip fractures? Because as I said, one hip fracture begets another one. Well, we can make our home safer. Start removing all the clutter. Move the furniture that can be more likely to be barriers. Move the magazine racks. Get rid of the throw rugs, which tend to slip and can catch your foot. We can improve our lighting, especially in areas which are not high light areas by tradition, our hallways, our stairways. Use night lights in our bedrooms or outside to navigate. Install safety devices. It's a cost, but a grab bar in the bathroom will prevent a fracture that's unwanted. And you can do grab bars around the toilet, the shower, and use non-slip bath mats. Be active. If you're active, if you exercise regularly, you improve your muscle strength, and that gets a long way to improving your endurance as well as your balance. Wear the right shoes. This is not a time to be vain. This is a time to support your feet so that they don't trip you up and lead to fracture rates. Maintain overall health, and we'll talk a little bit more about diet, calcium, vitamin D. Stop the smoking, stop the alcohol. It further accelerates bone mass loss and osteoporosis and increases your fracture rate. And everybody wants to be thin, but realize that being underweight actually increases your risk of bone loss. There are devices out there for people who are prone to falls, and I don't mean just walkers and canes. These are actually look like hip pads or airbags that are worn girdle-like, and they are likely to reduce the fracture rate in case you do fall. There's also smart belts that have apps and technology which send emergency alerts, sort of the help I've fallen and I can't get up kind of approach, but much more sophisticated to help us in case we do fall. This is the so-called fracture of the vertebra or the spine. It's a successive compression and crush fracture, which affects the bone, mostly in the thoracic or chest area. And this is the classic dowager's hump, the loss of height due to vertebral fractures, and it actually compresses your abdomen. And if you add that to the menopause bulge, you can see this body type is very obvious what's happened, and your clothes don't fit, and you're basically looking like you've gained weight, but it's not a matter of gaining weight. It's a matter of losing height and vertebral fractures, and can be associated with pain. So what do you need to do? Well, an ounce of prevention is worth a pound of cure. And so it's very important that we start with the things that we can control. And it's important to realize that you should get screened. The current recommendations from the U.S. Preventive Service Task Force is that all women over the age of 65 should have a bone mass density measurement. Perimenopausal women under 65 should have the measurement if they have one or more clinical risk factors for the fracture, including the secondary causes of osteoporosis. And it may even be beneficial to do an earlier screen in women under the age of 50, especially if they have high risk factors or a genetic basis for osteoporosis. In men, you're going to get this usually over the age of 50 if you've got clinical risk factors. And it's now been promoted that all men over the age of 70 might need to have this done too, because of the high rates of hip fractures and mortality. What is a bone mineral density test? It's a DEXA test. This is the machine on the right that is used. It's not invasive. It just you go on there, you lie down, and it measures the bone mineral density in your spine and your hip, and the whole thing takes about 10 minutes. The one on the left is used as a screening sometimes in doctors' offices, but it's not as good as the one on the right to be actually accurate. What are the scores? Well, normal is a score that's over -1. And it's a measurement that looks at and compares you to young adult females or females of your same age at that time. Low, and it also looks at the country. So there's actual measurements and standardization based on the United States versus Great Britain or other places. Low bone mass, which we said was osteopenia, is between -1 and 2.5. That is to know that you are going to become osteoporotic should you continue with the risk factors, or even, at the age of 65 plus. Osteoporosis can happen at any time, doesn't have to be just at the age of 65, and it's a score less than -2.5. And there's also a category called severe osteoporosis, which has greater than -2.5 on the DEXA scan, and even fragility fractures already. There's also an app which you can find called the FRAX, F-R-A-X calculator. People use this when you're in that sort of gray zone of whether you have full-blown osteoporosis or whether you're osteopenic or you're at risk for fracture. The FRAX calculator is a standardized calculator. You can just go online, Google it, and find it. And it makes a clinical diagnosis of osteoporosis predictive of when you're going to get a fracture within the next 10 years of your hip, your spine, or your wrist. And so you just plug in the numbers and it comes up with a score. If it's more than 20%, that's a high risk for fracture. If it's more than 3% for a hip fracture, then that too is a high risk within the next 10 years. So how do you reduce fractures? Well, one, you should be aware of your diet. You should look at your lifestyle. For those of you who are not big dairy drinkers or cheese or even ice cream, look at really your calcium and decide if you need a supplement. Usually for premenopausal women, it's recommended at 1,000, and for postmenopausal women, it's 1,200 milligrams per day. Vitamin D had been a blood test du jour that people were getting, and everybody was supplementing for it. It may require an actual blood test to be sure you're vitamin D deficient. If you are, you should be taking anywhere from 600 to 800 international units of vitamin D daily. Thinking that you're going to get enough vitamin D from the sun is variable, even in South Florida or in high sunny states. Regular weight-bearing exercises. These should be done 30 minutes a day, at least 2 to 3 days a week. These can be done with weights. They can be done with resistance bands. This is different than the aerobic exercises, which are at least 30 minutes a day, 5 days a week. You don't have to run and be a jogger. You can be a walker, but you should do regular exercises, but include weight bearing to improve your bone health. You should already be off smoking, so I'm not going to spend a lot of time on that. Really, smoking and alcohol should be limited, and in the case of smoking, completely abstinent for your bone health as well as your heart and other health. You should avoid drugs, particularly steroids that increase bone loss. And finally, you should mitigate the chances that you're going to get a fracture by looking at fall prevention. And fall prevention includes daily exercise. Beyond the lifestyle changes that all of us can do and should do, there's also pharmacologic interventions, especially in postmenopausal women and males over the age of 50. If we are in that category of osteoporosis, we should really look at mitigating the chances that we're going to have what's called a fragility fracture, especially of the spine, the hip, the wrist, the pelvis, the hip bone. The T-score greater than 2.5 on the DEXA for your lumbar spine or your hip is going to be an indication for a pharmacologic or a pill to reduce the chances that you're going to have a fracture and improve your bone density. A T-score between -1 and -2.5 at the femoral neck, hip bone, and spine and a predictive 10-year probability of a hip fracture greater than 3 or any related fracture greater than 20% is also an indication for medication. So that's the use of the FRAX calculator in the decision to whether you should be treated more than just lifestyle changes. These are the medications that are used, and they include hormone replacement, which does help. But typically we use the oral biphosphonates. There are newer ones which are also given in an IV infusion, and they are not given every day, but every 2 years, and also even every month. So there are a lot of choices out there, which we won't spend time. It depends on your risk. It depends on your side effects, and it depends really on the severity of your osteoporosis if you need to make a quick change in terms of your bone density. There are newer medications which are also called selective estrogen receptors for those women that are worried about taking hormones. They avoid the effect of estrogen on the breast because they are selective for those organs, particularly the bone, that have their receptors, and they don't affect your breast health. So with that, I want to reiterate that the goal of treating osteoporosis and low bone density is really to relieve any pain you might be having and avoid really the complexity of fragile bones and fall risks and fractures. The lifestyle modifications are very helpful, but if you've already reached the severity of osteoporosis, you are required, I think, to think about reducing your risk of fractures by taking medications in order to reduce and improve your bone health. You don't have to take them continuously. The current recommendations include a pharmacotherapy for 2 to 5 years and then reassessing. It includes drug holidays, especially with the oral biphosphonates and those that have low or minor bone deficiencies, and then it's reevaluated every 1 to 3 years. But for those that have high fracture risk and already severe bone density abnormalities, you're going to not have the chance of a drug holiday. What you're going to have is a reduction in your risk of having fractures. So pay attention to your bones. They are silent until you have a complication. And it's important to recognize that as women, we are all at risk for the development of osteoporosis, some more than others. Thank you. I hope you join us for our next podcast on the Hot Gals podcast site. Thank you again.